Stedman. He's a virologist and professor of biology at Portland State University. Thank you so much for joining us on the program today. Now, we're seeing the number of cases decrease in China, the epicenter of the virus, whereas the numbers rise in other parts of the world like Italy. What is the key method that countries with rising numbers need to adopt to get rid of this virus?
That's an excellent question, and unfortunately, we really don't know. It certainly in China, it seems to have helped a great deal to lower the number of people gathering in large places. Also, Korea seems to have done quite a good job in taking care of that. But I think the really big difference and really critical is to get lots of testing. You really have to have lots of testing so you know who has the virus and who they could potentially spread it to.
Well, there's a lot of panic that is surrounding this whole epidemic. I mean, we've seen people fight over toilet paper, but it's not as dangerous as people exaggerate it to be, right?
It really depends on what numbers you're looking at. And unfortunately, again, I hate to sound like a broken record here, but it gets back to the actual numbers, the numbers of people who are actually infected. And we really don't have a very good handle on that number right now. If you look at what's happened in South Korea, lots of testing, the actual, what we call the case fatality rate, so the number of people who've died versus the number of people who've been infected, is at about 0.7%. It's actually relatively low. But then if you look at somewhere like Italy, the numbers are much, much, much higher in terms of a case fatality rate, around 5%. And so what those numbers are, unfortunately, this is really an ongoing situation, and it's very hard to tell exactly how bad anything is. And I think that's why people are so scared, is because they don't know exactly how many people have the disease and, by extension, how bad it actually might be.
Okay, Ked, so just so we remind our viewers here, what should we be doing to minimize the possibilities of contracting coronavirus?
Say, number one thing, wash your hands and wash them for 20 seconds. Some people say that's singing happy birthday twice, something like that. The other thing is, if you are sick, stay home. Don't spread the disease to someone else. And then if you have an opportunity to be able to avoid large groups of people, particularly hundreds of people to thousands of people, do that if you possibly can.
All right, Ked, thank you so much for joining us on TRT World and sharing that analysis with us.